Good afternoon, my good people. Welcome back to my YouTube channel. And I do appreciate those who are commenting on our work and appreciating the educational bangers we are giving each and every day. Mostly people have found it useful because it's very educational. That's why I always encourage you people, if you are there and you are watching us and you have not subscribed, you subscribe and put the notification bell on so that whenever I upload any video, you will never miss it. YouTube will always notify you automatically. For the better part of the few days, we have been discussing about skin lumps or liposarcoma, their causes, their symptoms, and we started discussing the treatments whereby we talked about the steroid injections, we talked about the removal, which is the best, and today we will be discussing another way of managing a liposarcoma, which is called liposuction. What is liposuction? This is another treatment option. Since lipomas are fatty based, this procedure can reduce the size. So here you just suck the fat out. It can't remove the entire skin lump, but it just reduces the size. I hope we are together. A point to note: to prevent a lipoma from coming back, to prevent recurrence, or to prevent it from coming back, it's important that the doctor removes a lipoma in its entirety. So removal is always the best or the permanent solution to a lipoma because it won't come back or it won't recur. Liposuction is not guaranteed as compared to when it's removed entirely. Liposuction is not guaranteed as compared to when it's removed entirely. Lipoma, all part of it, may be under the skin muscle, which liposuction can't reach. Get this very clearly. Lipoma, all part of it, may be under the skin, under the muscle, or under the skin muscle, which liposuction can't reach. If you have insurance, you should check with your insurance provider to see if your plan covers lipoma removal. The cost of lipoma removal can vary depending on the following all factors which determine the cost of removing this lipoma. Number one, the size of the lipoma. Size of the lipoma or the growth. Number two, location of the growth or where it's located. Number three, complexity of the procedure. Size of the lipoma or the growth, location of the growth of the lipoma, complexity of the procedure. Sometimes these lipomas can grow in areas which are very complex and which are very difficult to handle. So this will determine the price or the cost. Most lipomas are small and can be removed under local anesthesia in an office setting. Most lipomas are small and can be removed under local anesthesia in an office setting. And at the end of this topic, I will attach a video whereby I was doing this procedure, and you'll be able to see how we usually do it under local anesthesia. Another point to note: the cost of removal may be higher if your situation requires an operating room or general anesthesia. The cost of removal may be higher if your situation requires an operating room or a general anesthesia. Risk factors. What are the factors that can increase the risk of somebody developing or having a skin lump or a lipoma? So the risk factors. Certain conditions may also increase your risk of a lipoma development and include the following. Certain conditions may also increase your risk of lipoma development and include: number one, adiposis docorosa or Dacham's disease, which is a rare disorder. These names may be so hard, but the most important thing to note is to know all about a skin lump and how it's managed. It's not very important to put in mind all these hard names, because they are just syndromes or some diseases that can predispose you to development of this kind of lipoma. Number two, we have Cowden syndrome. Number three, we have Gardner's syndrome. Number four, we have Madeli's disease. Number five, we have benign Ruvalcaba syndrome. Those are majorly the main syndromes that or conditions that can predispose you to development of a lipoma or a skin lump. The following conditions can also lead to development of lipoma. The following conditions can also predispose you to development of a lipoma. Number one, obesity. Number two, alcohol use disorder. Obesity, alcohol use disorder. Number three, liver disease. Number four, glucose intolerance. I hope you're getting this. Conditions that can also predispose to a development of a lipoma or a skin lump: obesity, alcohol use disorder, liver disease, and glucose intolerance. A point to note: lipomas are benign, meaning they can't spread throughout the body. They are just localized in the place where it is. It's not malignant. That means it's not spreading. Lipomas are benign, meaning that they can't spread throughout the body. You cannot reduce the size of a lipoma with self-care, warm compressions. You cannot reduce the size of a lipoma with self-care, though warm compressions may work for skin lumps but not helpful for lipomas, as they are collection of fat tissue cells. You cannot reduce the size of lipoma with self-care, but warm compresses may work for skin lumps but not helpful for lipomas, as they are collection of fat tissue cells. Warm compressors may work for skin lumps but not helpful for lipomas, as they are collection of fat tissue cells. This marks the end of our video today, and tomorrow we'll continue discussing the same chapter. And I hope those who had requested this chapter, you are following very keenly and you'll get what you wanted. Let's have a wonderful day.